Hello, I'm George Morris, the Physician Incident Commander for our COVID-19 response. I'm coming to you today with my mask on. This is part of my way to help control our spread. Universal masking is for all of us when we are out in public areas or certainly in our patient-facing and workplaces. The reason for this is to help control the spread, flatten the curve, manage the pace of the change as this virus and pandemic washes over all of us. I think what we've done as a state with our stay home order has really been to help delay that and flatten it out a little bit. Now with our governor's announcement last night, we're more of a stay safe. It doesn't have to be a stay home. Stay safe can include that, but it does mean that we have to try to do safer practices as the virus kind of comes through our communities. I understand there's a wish for, well, let's just get this over with, move forward, perhaps get everybody exposed at the same time, and that it really isn't that harmful. Well, the challenge is that this is a deadly virus. It kills people at a rate that exceeds other pandemics that we've seen and other viruses that we experience, such as measles, chickenpox, or influenza. This virus has long-term effects and mortality or death on a lot of our people and our family, and is something to keep in mind. I do know that most people will recover with mild symptoms. The challenge is we don't know who's going to be in what area. We also don't know what the long-term effects are. There are some post-inflammatory conditions that we're even seeing in our pediatric populations, where they could have some longer-term or some secondary damage that we will see, and we just don't know what those are yet. This virus has that name novel. It is new. It hasn't been around long enough for us to understand the long-term effects. Many of the other things that we do have, we know. This is what it'll do now. This is what it'll do 6 weeks from now. This is what it'll do 6 months from now. And what I'd like to say is that if each of us tries to stay safer at home, safer at work, safer for Minnesota, we can stay healthy as this pandemic does come throughout all of our communities. Thank you.